process of economic transformation. Just like that.
Okay.
The parish development model is an initiative from the government of Uganda through the Ministry of Local Government designed to transform all lives of Ugandans for the better. PDM, my parish, my development, my life.
Pick of the day on UBC.
Every Wednesday, 10 p.m. on your public broadcaster.
Was brought to you by
I'll call you every day, yeah, yo,
you can now get all the Chibuzi out with MTN voice bundles. Call all networks. Kubei Dondoro. Buy a 25-minute voice bundle for only 1,000 or buy any daily voice bundle of your choice. Dial *100 *21 hash and select daily or use the My MTN app. When we talk together, we are unstoppable.
In a nation hungry for truth, a world where every story matters, there exists a beacon of trust and reliability. For decades, they've been our voice and our window to the world, holding the mirror of our history. With 4 TV stations and 11 radio channels spanning 27 languages, they stand as guardians of information, defenders of truth. With Mascari Heritage Advantage, they uphold every citizen's right to reliable and free information. Their archived stories shaped our past and illuminate our present. Yet now, as new challenges arise and the world evolves, their mission faces its greatest test yet. Be part of our journey and let's navigate the unknown, uncover the untold, and safeguard our future together. Tune into your public broadcaster, for it is the intersection of trust and truth. Because to UBC, your story, every story, and every voice matters. UBC, inspiring Uganda.
The East Africa UK Tourism and Culture Expo 2024 is here, happening on 8th and 9th of November 2024 under the theme Enhancing Tourism as Engine for Social and Economic Transformation on the sidelines of WTM London at the Rembrandt Hotel, 11th Thurlow, PI South Kensington, London, SW7 2RS, United Kingdom. For tickets, exhibitors will pay £1,000 and participants will pay £300. For more information, call +256 787 096 100 or +254 795 806 969. Visit www.eauktourismexpo.com to register.
The Ministry of Health informs the general public that there are some cases of Mpox detected in Uganda. The ministry, working with partners and affected district local governments, are doing their best to contain the situation. The signs and symptoms of Mpox are body rash, fever, general body weakness, headache, sore throat, nasal congestion or cough, and swollen lymph nodes. You can prevent yourself from getting infected with Mpox by avoiding close contact with people who have been confirmed to have Mpox or who have signs and symptoms of Mpox, avoiding touching or sharing personal items like beddings, eating utensils, phones, or other belongings of a person who has the signs and symptoms of Mpox. Avoiding contact, including eating with all wild animals, alive or dead, especially those known to carry the virus, such as rodents and monkeys, and those that appear sick or have been found dead. Getting vaccinated if you're among those who have been identified to be at high risk of Mpox infection. Mpox is treatable and usually goes away after 2 to 4 weeks. However, it can be severe, causing even death, especially among children, pregnant women, and those with other health conditions. For more information and support, contact your nearest health worker. Call the Ministry of Health's toll-free line on 0800 100 066 or send a free SMS to your report on 8500.
At Uganda Development Bank, We are committed to empowering communities by supporting projects that unlock excellent economic benefits for Ugandans through job creation, tax contribution, output value, and foreign exchange. We seek partnerships with projects that drive economic development in Uganda.
Vocational education does more of equipping of different skills, ranging from hairdressing, tailoring, catering, and so on. So those are basically the courses that we do, and we do them in different levels. My relationship with UDB came through Yuga Privi. I'm registered with Private Institutions Association. So one time we were invited for a meeting as proprietors of schools. For some of us who are still developing. So Ray happened to be one of those that is not yet fully established. Of course, being a private institution, we didn't have enough structures. So I applied for a loan, and that is how our relationship started. And yeah, so I got the first installment, putting up the preliminaries and the substructure, and the structure is being worked on. I really want to thank UDB so much because the interest is pretty low, and I must say, UDB nafunamu. Thank you so much UDB for supporting vocational education.
Uganda Development Bank, inspiring development.
Uganda, are you ready to kick things up to the next level? The Uganda National Lottery brings you Sports Stake 10. Predict the results of 10 football games and win big. With tickets at only 500 shillings, join the fun and make your predictions count with Sports Stake 10. Sports Stake 10, your ticket to football glory.
Uganda National Lottery. Dream, play, win. Participants must be 18 years or older. Play responsibly. The Uganda National Lottery is operated by Ituba Uganda and regulated by the National Lotteries and Gaming Regulatory Board.
Live from UBC Studios in Kampala. This is Good Morning Uganda Extra.
Good morning and welcome to the extension of Good Morning Uganda. Now we start live broadcast at exactly 6:30 every weekday. Olive Najuma, Joram Paul Sonko, I, and later with Ruben Pima, who brings in sports, and we move into the extension, which is Good Morning Uganda Extra. Now this is a special day as we wait for the outcomes of the American elections. I know very many Ugandans are concerned because there is so much that America plays in how way things are being done. Even it be that political terrain, and when we come to them being as our donor partners, mostly in the area of HIV/AIDS or health in general, America does play a great role. So there are policies. Who comes in power? What is their policy when it comes to the African continent, when it comes to partners in areas of development? We can greatly get affected. However, this morning we choose to focus on health issues, and that is the Mpox, monkeypox. Well, globally, this is a threat now, and the World Health Organization, to a number of countries, they have been able to send vaccines against Mpox. How are we standing? When are they coming? What is the situation here? I have two gentlemen with whom we are going to be discussing this. Now, I have Chitambula Henry, who is the Deputy Resident City Commissioner for Kampala, in charge of Nakawa Division. In charge of Lubaga Division. You know, he was in Machindi, and then, but most welcome, my former
IRCC. Thank you very much. I'm humbled to be here. I've taken long without appearing. I've been a bit far away from Kampala, but I thank God that I'm back in Kampala. You can call me Chitambula too, but this time in Lubaga, and we are here to talk about a very serious matter, as you'll introduce. I've come in two capacities. One as the Deputy RCC Kampala in charge of Rubaga Division, but also as the chairperson of the task force on all diseases, all infections mentioned. So this time we are having Mpox, and I'm the one chairing and heading that task force. So I greet the viewers, and I ask them really to listen, to view, and get some information on what we are going to discuss.
And then just next to me, I have a medical doctor from Chitambura who heads a task force. Now, since these are matters of health, I have Dr. Buluma Dennis Mike, who is the Supervisor, Medical Services, Kampala Capital City Authority. Doctor, you're most welcome.
Thank you, Bwana. Good morning, viewers, and I'm happy to be here to share with you part of the information we have on Mpox outbreak that's currently ravaging us in this country.
Now, Doctor...
And he's also here as the Secretary of the Task Force.
Secretary of the Task Force. Well, people are having so many quotes this morning, but what is important is we are discussing a health issue and where we are having an outbreak, even in our country. Now, let me begin with the doctor. Doctor, to our viewer, in the simplest terms, when you talk about Mpox, what is it? A viral? Is it an uncommunicable disease? What is this?
Thank you, Bwana, for that question. So our viewers need to understand it is an infection primarily housed in animals that stay in the rainforests. Is previously or commonly found in the rainforests of Congo and West Africa, but it's also now currently found in other countries. And it's not been in Uganda ever since, but this year, from July, we registered the cases here in Uganda. And since then, the number of cases has been increasing, like we shall be discussing here. So it's a viral infection caused by a virus called Mpox virus. That virus is related to the smallpox virus, a virus, or a virus that used to cause smallpox. You know that we eradicated the smallpox. So we no longer have smallpox, but monkeypox is in the same family with that smallpox. So it is a viral infection that can be got from wild animals through interaction with the wild animals. And then once it is in a human being, then the human being is able to transmit it to another through contact. Through contact could be through body contact, contact through sexual activity, or even contact through body fluids or touching surfaces or items that an infected person has touched. For example, his clothes or her clothes, or surfaces where that person has touched. So that's how it is primarily transmitted, although we also know that it can be transmitted through the air. If the infected person is near you and they either cough, sneeze, or do anything where he releases, droplets through the air, then if you are that near, you can also get it through the airway. So it is primarily transmitted through those major routes. The other route is, of course, through contact with the wild animal. It's commonly found in squirrels, rats, and monkeys. So previously it was called monkeypox, but the official name now is Mpox. Mpox is the disease. Thank you so much.
Okay. Now, having talked about Mpox, and I believe our viewers now know what this is, but still, before I go to Chitambura, still to create a picture, what are the signs that someone can look up to and say, well, I need to keep social distance, or I need to avoid something like that? Yes.
So the signs that could show somebody may be having Mpox initially starts off like normal fever. You get a fever, you get a headache, you get muscle pains or weakness, general weakness, and then you may have a sore throat, and eventually you get a body rash. Now that rash could appear in any part of the body, but eventually it could, go on the whole body, become a generalized body rash. The rash wants to look more like for chicken pox. In many cases, it's actually mistaken for chicken pox because people have not known this disease before. But we are saying in the current circumstances, now that we have this outbreak, if you see anybody with the symptoms or rash that seemingly looks like chicken pox, because I know Ugandans know chicken pox, it is likely to be monkeypox. So we need to quickly notify the health workers or go to a nearby facility so that a sample could be taken off, and then we identify the actual cause and help that person get better. The disease can be treated, especially in the early stages. It can actually be very severe though, but it can be treated. So we want to tell our people, once you see these signs, one, avoid contact with the infected person, but more importantly, alert the health authorities so that we give you guidance on how to go about it to avoid it spreading further in the home or in the place where that person is.
Now, this takes me to the head of the task force that is in Uganda. Let's look at our situation as a country right now when we talk about this outbreak of Mpox.
First of all, the situation is under control, but we need to add in effort. When you look at the national figures, we have 378 cases in 28 districts. And Kampala, where we are, I think has the leading cases. Because Kampala alone has 131. Kampala alone. Then Wakiso has 55. Mukono has 13. So that means Greater Kampala has 199 out of the 378 cases of the entire country. So that means Greater Kampala, we must add in a lot of effort, because really the situation is alarming. So that is the status of the country. And Rubaga, we have cases. By last week we had 7 cases. I've been told that we have added on around 5. We are yet to confirm, but the 7 cases are confirmed. And out of the 7 cases, at least 3 got treatment and healed. We only have 4 that we are managing. So we are putting in effort to ensure that first of all, and our policy as a government, we look at prevention most. We have fought very many infectious diseases through prevention, and prevention goes with the sensitization. So as the head of the task force, we have held several meetings. We are trying to reach out various stakeholders to ensure that they assist us to send information to the last person. When the last person gets the message, then we shall be very, very, very okay. We shall manage the situation. I'm glad that my secretary here has organized another meeting that we are having on Friday, involving all the local leaders. So we want to thank the development partners who are trying to assist us in facilitating some of these community engagements we are having. I've been told that we're also having another arrangement for Kampala through my boss, the RCC. So all of those efforts are geared towards sending the message to the people. And Ugandans who are viewing, we should take this disease very seriously. We should take it very seriously. Of course, the death rate is low, but we need not to take any chances. So the local leaders are key. So those other people from other districts, kindly make sure that you engage the local leaders, the local council 1 and 2 chairpersons or committees. Then we have our VHTs. So for us, we are meeting the VHTs, because those village health team people are very, very instrumental, because they're always near the last person. A doctor here has been talking about the animals, the dangerous animals. And you know that many of our people stay with the rats. Many of our people, many houses, many households, you can find a rat, 1 or 2. And those rats at times come to the houses but also go to the bush. They interact with the monkeys, squirrels, mentioned. So that means we need to take care. Don't just touch a rat. If you, for example, trap it and it is caught, when you remove it, make sure you at least wash the hands. In fact, the major preventive measures are not different from what we did to COVID. Don't touch the body of somebody. So handshaking should not be part of us. Don't kiss, because when you kiss, you can contract the disease. Don't touch an animal. Don't go for hunting. There are those who hunt even squirrels, and there are those who skin. You are skinning a squirrel, just a small animal. You are even if 20 hunting it. It is around 2 kilograms or even less, but you are causing us problems. So that hunting should be regulated. So the local leaders should regulate that hunting. Then there are some other areas with monkeys. Even some hotels. I was in Jinja and I saw one with monkeys. Then the other time I was in Maya, I saw monkeys everywhere. Those monkeys are not so good at the moment, so don't touch. Even if you want to touch, don't touch. Then make sure all the time you sanitize, wash the hands, because you never know. I can touch here when somebody infected touched. So let me from here wash my hands, say that I'm safe, and when I'm safe, another person or my neighbor is also safe. When you see the signs, I don't know, the doctor will add on those signs. When you see those signs, make sure you don't move to the communities. Isolate yourself for a while. And then we have 2 toll-free lines. For Kampala, especially Lubaga, we have a toll-free number which is 0800 299 then 000. That is for Kampala. But we have the national toll-free number of the Ministry of Health for those who are not in Kampala. That number is 0800 10006. That is for the national, for the Ministry of Health. But you can also send a message on your report. To your report. You can send a message to your report, and the SMS number is 8500. 8500.
So that is how you can get help. We are still in Good Morning Uganda Extra and look at the current state of Mpox in Uganda, understanding Mpox, transmission and prevention. Now, Dr. Chitambula hinted that so far the death rate is low. When we talk about the treatment of Mpox, I want to bring in, like when we had times of COVID-19, we reached where treatment was a miracle. Mpox, how is that treatment and the recovery rates?
Okay.
And where do I go to if I'm suspicious that this could be Mpox? Because someone is also discover a rash, and because they've had, which is also good, but then the panic, you're a doctor, the panic that comes with a suspicion of a terrible disease or a terrible infection, there is a way that one has to have the right information of where to go to.
Right. So thank you very much again for that question. So the treatment for Mpox is supportive treatment, what we call supportive treatment. So because it's a viral infection, we do not have a particular drug that kills the virus. However, we have medicine that will manage the symptoms that the patient has so that they recover quickly. For example, if somebody has a headache, they need a painkiller. If you have a fever, we need to lower that temperature because a high temperature injures your body organs. If you have a rash, that rash can be painful, can be itchy. You need some medicine to ease the pain, to ease the itching so that you don't scratch yourself and create more wounds that will be infected again by other organisms. So we give you that treatment. You may be dehydrated. We may need to rehydrate you. So we give you treatment in accordance with the symptoms you have. And that's why it is important that once you suspect you have Mpox or any illness, go to your nearest health facility. We have empowered most of our health workers to actually know the symptoms of this disease and be able to know if this patient has Mpox. They have also lines that they call for assistance. As a nation, we have set up, just like we had during COVID, what we call a treatment units for Mpox. So for Kampala, Wakiso, and Mukono, the KMA area, our treatment unit for Mpox is in Entebbe, where we used to treat COVID cases. So Mpox, if once it's confirmed, we've taken off a sample, the laboratory confirms this person has Mpox, we have a mechanism of evacuating or transporting the infected person for specialized treatment in Entebbe. And the recovery rate is quite high. So far, of the 378 cases, we've not lost any. That's good news. So the death rate, like my RCC has said, is not as high as for COVID. That should not though make us not, take precaution. It's a dangerous disease. It makes you sick. You cannot do anything, but it can also affect a very large community. So once you're sick, we take off a sample, and then we take you for treatment. In 2 to 4 weeks, 2 to 4 weeks usually, you have healed, and then you return home. However, also important to note, let's not panic. If you see somebody or you think you have the signs and symptoms we've talked about, call the toll-free line that we have said. You will receive additional information and proper guidance on what exactly to do. But in that moment, don't panic, but also do not mix with the household or community members. Like we've said, it is transmitted from one person to another through contact. So you having the symptoms and you interact with another person, you will give them the infection. So if you are able, for example, if you have a cough and all the other symptoms and you suspect it is the one and you are home where the other people, put on a mask, right? Wash your hands frequently. And toll-free line so that we guide you to receive care, which starts with a health worker evaluating you and then taking off your sample if we suspect you meet the case definition for Mpox, and then your sample will be shipped to Entebbe for testing. Once it's confirmed, then we shall assist you to take you for treatment in Entebbe. Thank you.
Maybe for avoidance of doubt, he mentioned some of the symptoms. I need to give them a list. One is skin rash. The moment you see that, then fever, he mentioned it, sore throat, headache, body ache, back pain, low energy when you have general body weakness, then swollen lymph nodes. So the moment you see those signs, then don't hesitate to isolate yourself and call for assistance. It can be one symptom or a combination or 2 or 3. So whether it's 1, whether it's 2 or 3, or all what we have mentioned, kindly you call those lines, say that they can pick your samples and take you for treatment.
Well, pick your samples, take you for treatment, and the recovery rates are very encouraging. we've lost none so far at our treatment centers. Allow me go for a short break. When I return, I still have the doctor and the resident city commissioner Kampala in charge of Rubaga. We're discussing Mpox. We return.
Live from UBC studios in Kampala, this is Good Morning Uganda Extra.
The Ministry of Health informs the general public that there are some cases of Mpox detected in Uganda. The ministry, working with partners and affected district local governments, are doing their best to contain the situation. The signs and symptoms of Mpox are body rash, fever, general body weakness, headache, sore throat, nasal congestion or cough, and swollen lymph nodes. You can prevent yourself from getting infected with Mpox by avoiding close contact with people who have been confirmed to have Mpox or who have signs and symptoms of Mpox. Avoiding touching or sharing personal items like beddings, eating utensils, phones, or other belongings of a person who has the signs and symptoms of Mpox. Avoiding contact, including eating, with all wild animals, alive or dead, especially those known to carry the virus, such as rodents and monkeys, and those that appear sick or have been found and identified to be at high risk of Mpox infection. Mpox is treatable and usually goes away after 2 to 4 weeks. However, it can be severe, causing even death, especially among children, pregnant women, and those with other health conditions. For more information and support, contact your nearest health worker. Call the Ministry of Health's toll-free line on 0800 100 066 or send a free SMS to YouReport on 8500.
The East Africa UK Tourism and Culture Expo 2024 is here, happening on 8th and 9th of November 2024 under the theme Enhancing Tourism as Engine for Social and Economic Transformation on the sidelines of WTM London at the Rembrandt Hotel, 11th Thalo, PI South Kensington, London, SW7 2RS, United Kingdom. For tickets, exhibitors will pay £1,000 and participants will pay £300. For more information, call +256 787 096 100 or +254 795 806 969. Visit www.eaukTourismExpo.com to register.
Uganda, are you ready to kick things up to the next level? The Uganda National Lottery brings you Sports Take 10. Predict the results of 10 football games and win big. With tickets at only 500 shillings, join the fun and make your predictions count with Sports Take 10. Sports Take 10, your ticket to football glory.
Uganda National Lottery. Dream, play, win.
Participants must be 18 years or older. Play responsibly. The Uganda National Lottery is operated by Ituba Uganda and regulated by the National Lotteries and Gaming Regulatory Board.
Live from UBC studios in Kampala, this is Good Morning Uganda Extra.
Welcome back from that break, and thank you so much for being with us on UBC TV. It is the Extra, Robert Chirabo Nyonyintono, and with me I have the Deputy RCC in charge of Rubaga Division, Chitambura Henry, who happens also to be the chairperson of the task force when it comes to Mpox. And I also have Dr. Buruma Dennis Mike, who is the Supervisor Medical Services, KCCA, and the Secretary of the task force. We are discussing Mpox. Now, the good news is that we've not lost anybody due to Mpox. However, you should not clap hands for that, because we have over 300 cases. And if we don't do much, these numbers will increase. And one of the things in disease management is if numbers increase, you're overwhelmed. And many end up succumbing to death. So we don't want such a situation. This is why I bring in Chitambura. So far, what are the steps that we are taking to contain? Because Ugandans, we saw this even during COVID-19. At one time, even reasonable force had to be applied. When you talk of people don't mix night, everything, life is still normal, as if you have nothing with us.
I think Ugandans learned from the COVID experience. They also learned from other infectious diseases that we have been having over the years, including Ebola and so on and so forth. So these days when you tell them that we have this outbreak, like Mpox, and it's very, very dangerous, the moment you give them the preventive measures, they will always listen and take them up. Ever since we started this campaign with our team in Rubaga, people are no longer shaking hands, though some of them still do this. So we are telling them even this is not good. They call it kubonga in Uganda. So when you do this, you may end up touching your face, or touching any other your eyes or ears and so on. So we are telling them even that is not good. So we are looking at the schools, we are looking at the prisoners, we are looking at those working in markets, those in trucks parks, and those other areas that really have big crowds of people. People have washing can have that. So generally our focus, and it's the most important step, is sending the information on how one can prevent this infectious disease, Mpox. For you who is in the media, maybe once in a while you can show us. There is a picture, if we had known we would have sent it to you. The ministry is using it, is using that picture. Somebody is facing the other side, but they are showing you the back. And that back, when you look at it, you may think is, I don't know, because the back is so rough with the rashes and everything. So once people see that, and especially those who have ever experienced the other smallpox, when you tell them that this is almost similar to that, they can listen and really avoid contracting the disease. So that is the focus, and I think every leader of our level countrywide should focus on disseminating information on the preventive measures, and where somebody who is suspected of having contracted can go for treatment. So as the head of the task force, that is the focus we are on, and I'm glad we are having very many meetings of very many stakeholders to ensure that we achieve the target.
Well, efforts being put in place. Now I go back to Doctor. Recently, a number of countries have received vaccines against Mpox. Now, we know that being vaccinated doesn't prevent you from acquiring that disease. However, it boosts your immune system. That should you acquire the disease, you'll not deteriorate, but still need treatment. Like famously, we know the measles vaccine, that when a child is vaccinated against measles, they will be playing. Of course, they will get some vitamins and treatment maybe against those, but they will be playing and enjoying life. Whereas those that weren't vaccinated will have an opportunity to look into their grave and maybe make it or go forever. Now, Doctor, how are we standing at this, or is still far-fetched given the cases we have?
Thank you, Robert, for that question. So one of the measures to control Mpox globally is a vaccine, like you've rightly put it. So a vaccine exists. However, the vaccine that exists currently is not, Uganda hasn't made preparations to have it yet. They are not yet underway. But also that vaccine wouldn't be for mass vaccination like we did for COVID, or for mass vaccination like we do for measles. It would be for communities or populations that are at most risk. So although anybody can get Mpox, there are groups of people that we know have an increased risk of getting this Mpox. And these are the ones who would be targeted. Even those countries are the ones they are targeting to vaccinate. One, as a sign of, cost management, because the vaccine definitely costs money. And so if you have less of the vaccine, then you prioritize the people who are at the front line. So the people who are at most risk are frontline health workers. So health workers who are tending to the sick, and then our colleagues who engage in what we call commercial sex work. They are at increased risk. And then pregnant women will be at increased risk, and children under 5 because of lower immunity, plus people who have other conditions that lower their immunity. For example, people living with HIV/AIDS, people who have diabetes, people who have cancer or on cancer treatment. So those conditions that lower your immunity make you more vulnerable to develop a very severe disease once you get in contact with somebody with Mpox. So vaccination would be for that category, but as a country we've not yet moved to that step. Yeah, so for now we are focusing on ensuring that we stop the transmission from further attacking other people, so that we may not reach even that step. Yeah.
Now, Chitambula, when we talk about information, it is power and sensitization. But when it comes to Mpox, brief assessment, how are Ugandans knowledgeable about this? And of course, how have we tried to send this information to them?
Many Ugandans, because I've even had an advert here, so many Ugandans are getting the information through
public awareness,
through media. Recently, the ministry has come up with some posters as well. What we have been, I think, slow on has been the engagements, the community engagements. But we are in full gear to ensure that the community engagements are carried out and they are effective. So, as I said earlier, we are looking at the stakeholders who can assist us, the local leaders, the VHTs. In fact, when you look at what we have set as what one should do if he or she thinks that he has Mpox, we are having around 5 areas. The first thing we are saying is stay at home and inform your VHT or community health worker. So that means we must sensitize the VHT and or the community health worker. Then number 2, we are saying you as an individual, tell everyone you have been close to recently. You say, I have the signs, I've been with you. So that means you are contact. So as I go to seek for treatment, as I go or as they take my samples, they should also follow you up. So this Ugandan will assist the health team to trace those with whom he or she was, so that if he or she is infected, then the other ones can also be managed. So that is what we are also doing. Then number 3, as we said earlier, when you have it, then avoid physical contact with others. And even if you don't have it, but you suspect that there are those who could be having it and they don't want to go for treatment, then report. those cases in your community to the VHT, or you can use the toll-free lines that we have given you, and we shall repeat them towards the program. So basically, when we have the media campaign, when you have the posters, and then the community engagements, beginning with the stakeholders, because the stakeholders will make the information trickle down to the last person, then I believe we shall have done our role, and believe me or not, we shall have this Mpox virus no more in this country. So I'm calling upon Ugandans, whoever has got the message, kindly don't keep the message for yourself. Spread the message to your neighbor. Spread the message to your household, to your family members. And if you are infected, or if you suspect that you have the signs, then make sure you tell the family members not to mix, to share a lot of things with you. You do what we call social distancing. Isolate yourself for a while, so that you don't cause problems to the family members. And I believe once we do this, then we shall have done our role. And I want to assure Ugandans that this is manageable if we are disciplined and adhere to what we are saying and what the technical people are telling us. Then we shall have a country free from Mpox.
Well, it includes here being very good at neighborhood watch, because a neighbor may have these symptoms and the signs and conceal themselves. So even if you suspect, looking at the signs, let the health workers know, because these are people, at one point, either your children will mingle with them, or somehow you may touch a contaminated surface by the neighbors and you're not aware. Doctor, as we come to the end, when we talk about Mpox outbreak, are there prominent areas so far that we can say maybe in this the cases are so high, here the cases are so high, and there are more of risk areas?
Okay. Yeah, sure. So we've said Mpox is a national issue because it's now currently affecting over 28 districts, although Kampala has the highest number of cases. But even within Kampala, the 5 divisions of Kampala don't have the same number of cases. So currently, Kawempe division has the largest number of cases at 75. So of the 131 cases in Kampala, 75 of these are in Kawempe. And I think the most affected areas are areas around Bwaise area there. And so we want to call upon our people to be extremely more careful. Central Division has 12 cases. You would imagine Central would have more, being the CBD with a lot of people. Nakawa has about 16, Makindi has 16, and Rubaga has 7, although we have another 5 that we are yet to ascertain. That would make it 12. So that is the current spread. And even within those divisions, of course, these cases are coming from particular parishes or areas. So the most affected areas are usually areas around bars or streets, what we call red districts. I don't know whether you can understand
they
that.
Understand.
Yes, so areas around what we call red districts is where mostly this has been. And then, of course, it's also among now the clients who frequent those
those that go for the ladies of the night.
And then, of course, then when they go back, then they have the families, the children get affected because they're interacting with mommy and daddy, and then the house help who washes the clothes and things like that. So we've also seen a few cases beginning to go to schools, and that is very dangerous because a school community has quite a high number of people. So that population, fuels the transmission. So if you just have one case in a school, you can have an entire class affected. So we are calling upon all school administrators to be extremely more careful, look out for children with these signs and symptoms, and quickly alert their parents to take these children, but also call our toll-free line so that we come and help, take off samples, but also manage the cases to avoid them spreading. And so we are doing some school sensitizations. We have teams that are going out to schools to sensitize the school managers, but also talking to the learners and sensitizing them about these signs so that when they see them as themselves, they report to the school managers so that we manage these cases not to spread out. So that's what we are doing, and we hope that we can be able to contain this. We also want to thank our development partners for the support. An outbreak usually happens, when it's least expected, and as government, we usually call upon partners to support us. So we've received a lot of support from partners, and we continue to seek more so that we have a concerted effort to fight this outbreak and end it quickly. And we thank those who are already working with us on this front.
Maybe I can add on the issue of
the
school.
In your parting shots, yes.
On the schools, he has mentioned about the school administration taking care of these children. But we know that most of these children are going back for holidays, and it's a very long holiday. So my appeal to the parents, when the children come back, don't allow them to just move anyhow, because they can move and then contract the disease. But also, when a child comes back and you see that that child has some signs of Mpox, don't hesitate to call the team for management, because they have been mixing with fellow children, then the transportation to homes. You never know, all that journey from school to home, they may get some issues, they may contract the disease. So I'm appealing to them to ensure that at least they monitor their children. I want to re-echo the numbers that we want them to call.
Yes.
For Kampala, the number is a toll-free line. You don't pay for it. Whether you have airtime or not, you can call. It is 0800-299-333. That is for Kampala. But for the Ministry of Health, that is the national one. For those in other districts, you can call 0800-100-66. You can also send an SMS to your report on 8500. Whether SMS, whether you have called a toll-free line, by the way, even if you're from Kampala and for you think you can call the ministry toll-free line or send an SMS, then the ministry will definitely call the team on the ground to take charge of the situation. So either numbers you are free to call, because they are all numbers that the government has put in place to ensure that we get quick communication on those suspected to have the signs, and even those who want to report any other matters concerning Mpox. And kindly don't make the numbers busy when you don't have a genuine reason to call, because there is also a tendency of Ugandans. Somebody can make the number very busy, and really shuts the chances of other people who could be having genuine cases.
We had a similar, we had something like that during COVID.
I don't know whether you...
The numbers that were being
yes,
given,
that's why at times
they were engaged all the time.
That's why at times we fear to give our personal numbers on when we're on TV. When you read the number right now, people will call when you're even in the studio. So there is that behavior of Ugandans. So I believe they will call when they have genuine reasons. And I don't know how many minutes we are having, but I wanted to say that the battle is a battle we can collectively fight. Let us play. Each of us play his or her roles to ensure that we overcome Mpox.
Well, I just want to thank you, gentlemen. That is Dr. Buruma Dennis Mike from Kampala Capital City Authority, the Supervisor Medical Services and Secretary of the Mpox Committee, and Henry Chitambula, who is the Deputy RCC Kampala in charge of Rubaga Division. for your time, and above all, you our viewer, those that have been with us from the hour of 6:30 in Good Morning Uganda, then the extension, the extra. We really don't take you for granted, and we want to appreciate you. Fellow Ugandans, this is a battle we can win because we've won so many. Let's follow what our scientists, I love the words of the president, what our scientists, the doctors, tell us to do. And of course, all leaders, it is time to ensure we join the fight at whatever capacity. LC1s, please, and your committees, be vigilant. Let's together end Mpox. Have a lovely day.
Live from UBC Studios.